special segment of Let's Walk with Mercedes Med TED Talk. I'm your host, Mercedes Med, and you're watching HSCI, the Ultimate Team News. Hospitals are a place of care, and yet many shudder at the mention of going there. Whether the reasoning is due to financial struggles, fear for the future of their health, or worried about medical procedures, oftentimes more than not, it's all of the above. So how can we find a way to fix this? Professionals are stating that integrated practice units, or I.P.Us, are the way to go when balancing budgets for a hospital to run efficiently. Here to discuss more about the integrated practice units is our resident specialist, Merce Lemsky. Merce, how are you? I'm well, thank you for having me. First off, let me explain to you what integrated practice units are. I.P.Us are a specialized multidisciplinary practice team who are trained to provide the necessary care for patients with extreme cases. While many hospitals are pushing for technological advancements, their budgets simply won't allow them to. The current issue with the hospital budget is how it is dispersed throughout the different departments in the building. In the current hospital system, the budget is constructed by a clinical and an ancillary departments, with each having their own separate budgets. Although one department could ask for assistance when needing a little extra for their specific equipment, we would call this co-investing. It would be extremely difficult, if not nearly impossible, due to each department having their own expenditures. What about having one total budget for the whole hospital to use? That would surely make it a lot simpler in terms of budget handling. While a centralized budget for all departments in the hospital sounds nice and easy, it would severely impact the production in the workplace rather than increase it, due to the monetary source being spread way too thin. I.P.Us would be cost-effective due to their ability for particular and specific usefulness at a certain stage in treatment. Having this kind of technology will produce a much better quality of health while still providing the potential of reducing the cost of care for that specific condition. Do you believe I.P.Us are the solution to hospitals' budget problem, and is that the only problem it can fix? I.P.Us are the solution to multiple problems, such as overpricing patient visits, borrowing money from other departments, and overall technological advancements in the hospital. Has this procedure been done before? Yes, this procedure has been successfully implemented in many organizations that provide both primary and specialty care. How will the new I.P.U system affect patients' current insurance plans? While the payment plan will try to be accommodating toward people of all income statuses, the overall price will vary based on illness, usage, and location. What is the ultimate goal for implementing I.P.U teams across hospitals everywhere? Our goal is to identify primary care practices that represent the principles of I.P.Us. Each member of the team has an important function toward meeting this goal. The team would consist of a medical receptionist, a medical assistant, registered nurse, a physician, and a physician assistant. Ultimately, the goal is to develop multidisciplinary teams and send them to each patient placed in new pods. These new pods are a new development we are under the works for, to develop proper and more individualized care. Lastly, what future challenges do you see for I.P.Us ahead, if any? Progressing forward, there are some minor problems with the integration of the specialty care, along with the continual technical work with our reimbursement plans toward the bundled and other packages provided. Thank you, yes, thank you for having me. Take this mic off. Alright, cool. Utilizing the hospital's budget to form I.P.Us will allow departments to give their patients proper treatments they need while maintaining a low cost of care. This is what local hospitals should be prepared to do. I'm your host, Merce Lemsky, and this is me, signing out.